Well, it strikes me that what you're sharing can actually be applied, and there are a number of us who serve in interreligious and interfaith settings. And I think that this stems beyond Christianity and is simply about common humanity, where we're talking about things like forgiveness, things like anxiety, things like crisis. And I wanted to ask you sort of a question that dovetails with that. I'm curious to hear about how clinically those of us who work with youth should, what we should be on the lookout for. I think many of us who have experience working with youth have a lot of uh, training, or at least enough insight to be on the lookout for sudden changes in clinical behavior, so which can be warning signs and triggers, right? But we're talking, with COVID and with racial justice, about things that are so much more pervasive and long reaching and far reaching. Is there anything else that those of us who work with youth can keep an eye out for? What are the things that we really should just kind of be focused on? And I think that's something that can transcend even just churches, and can some of our group work in nonprofit and again in interreligious and interfaith settings. I'm curious to hear what you would say to those folks, what we can do.
Sure. So we all do experience anxiety, as we've already been talking about. And in fact, what's interesting in the research is that a healthy dose of anxiety actually allows us to perform at our peak, which is actually a great thing. So being a little bit nervous and anxious about that test we're going to take actually helps you because it taps into like memory and et cetera that otherwise wouldn't get tapped. I think the real key question here, though, for us to assess is debilitated by it? And what I mean is it impacting their functioning? Right? When there's a major crisis or trauma, we tend to go into survival mode and often will respond in one of two ways. One is either becoming extremely hyper or becoming extremely hypo. And I'll give you some examples of that. So we might see some major changes in their routine. So sleep. Either if they're hyper, they could be sleeping too much, not even being able to wake up sometimes, right? Some of us experience this in the mornings because at night we can't sleep and our mind is just reeling and the anxiety is there. So they could also be hypo in that maybe they're not getting enough sleep and that's really impacting them. And if you look at the brain research related to sleep, it's astonishing because when your brain is not functioning the way it's supposed to, there's no way they can learn, there's no way they can actually, do all these other things. So sleep is a major sign. I would also say, going with the hyper and hypo, eating and appetite. Are they hyper, meaning is that all they're doing because they feel like that's the only thing they can control? Or is it hypo, they've lost their appetite and there's just no desire, right? And that's a major concern. Concentration, same thing. Are they hyper concentrated on certain things versus just checking out and detached from other things? That's another kind of thing to watch out for. Another thing is response to triggers. Are they hyper responsive to triggers or are they hypo again? And again, we have to really think about, is this part of self-protection and self-preservation, or is this something that's out of their control? And I would say, right now, I think we're all experiencing what's called acute stress disorder. So, this happens, when something happens, we have this acute reaction. And I think all of us are experiencing that and our kids as well. I think the thing we have to watch out for is that acute stress can now turn into post stress traumatic disorder, right? PT or post traumatic stress disorder, PTSD. And that's on a whole different level because that can go on for years and years and years. And so when you see something cute, just know that right now that's probably a very ordinary reaction to what's happening. But let's say next year at this time, you're still seeing those symptoms, then we know that there's something going on. In fact, you don't have to wait till next year. If it's more than a month, right, and you're seeing some of these things where the child's life is debilitated by this anxiety or the triggers or the stress, then that is high time for us to connect with somebody that can help them. And by that, I mean a professional, psychologist or a therapist or a counselor. I also want to say, as churches and youth organizations, we always have to have a running list of candidates of therapists who represent our youth, who are readily able to work with them. So if you don't have that running list yet, this is a great time to get that list together. And what I mean by a list is not just people you pull off from the internet, but you've actually connected with them, you've shared with them about your ministry and your vision, and you've also connected with them about, should this happen, are you somebody that I can call on to come and help us, right? And if you don't have that running list and that working relationship going, this is a really great time to get that started. And I would say that's even beyond the pandemic or anything else. When we're working with youth, we always have to have that. If you're a white organization and you have a few minority students, then guess what? Make sure those students are represented in the people that you call upon, right? Especially at this time, because that sends a great, really important message.